Hi, my name is Marta Anderson, and today I have my horse Blondie and my handler Stephanie. They're going to help me demonstrate bandaging for a horse. Now there's something you need to understand about bandaging. The purpose of bandaging is for protection of the horse's legs or to cover a wound or keep a leg clean. The purpose of bandaging is not to support the leg, because in order to support the leg, you would have to immobilize the fetlock joint, and that would be like putting a cast on the horse, and you cannot expect him to work with a cast on. The first bandage that I'm going to demonstrate is the polo bandage. This is the kind of bandage you would use for riding or work to protect the horse's legs from him interfering with himself or from hitting a rail or something else while you're riding. To do the polo bandage, you want a bandage that's a little bit stretchy. And what I'm going to do is start on the inside here against the bone rather than against the tendon. This helps protect the tendons from places getting too tight and cording. So what I'm going to do is place the inside of the bandage right against the bone in the groove here. Go around and then down his leg. I want to wrap evenly and with smooth wraps. When I get to this point on the leg, I want to angle down and follow the fetlock joint around the back, making sure that there are no wrinkles that could cause any restriction in blood supply. Then I follow the bones of the fetlock joint back up and make an upside down V in the front. This allows for flexion in the pastern area. Then I'm going to come straight back and cover at least half of this, so this back loop cannot be pulled out by a back foot accidentally catching it. The whole time I'm going to keep both hands on so that I can feel any problems and smooth out any wrinkles that are starting. Then I head back up the leg with even wraps, and my goal is to end right below the knee. Okay, so here you can see that I ended right below the knee. I just went around the fetlock bones here, and I have an upside down V in the front. This allows him to flex, but it protects the place on the leg that is most likely to be hit by the other foot. Now it's important that this wrap is not too tight, or else I can cord the horse or cause a bandage bow. This is when blood flow is restricted to an area, so I'm going to check. I should be able to slide a finger in the top of the wrap, and I should be able to slide a finger in the bottom of the wrap right here, but the wrap should not be so loose that it will slide down or come undone while I'm riding. So what I'm going to do is attempt to twist it or move it or slide it down, and as you can see, it stays in place like it should, but it's loose enough that I can slide a finger in. This is what you're looking for. In addition, my wraps are even so that it looks like a nice boot on his leg rather than it's wrapped around. The next wrap or bandage that we're going to demonstrate is the standing bandage. This is not used for work. Rather, it is used for either covering a wound on the lower leg or helping to prevent or drive out swelling. There are two parts to this wrap. There is the pillow or a quilt, and then you have your track bandage. What we do is we apply the pillow first, and then the track bandage holds it in place. I'm going to let Blondie on here. And like our polo bandage, you want to start on a bone and wrap as evenly and consistently without wrinkles as you possibly can. So we start just below the knee, and it should go to just below the fetlock. And I want to make sure everything is tucked in as much as possible. The better that I apply the pillow, the easier that the track wrap will go on. Once I have this bandage in place, then I start right about in the middle with this wrap. And I just want to go once around, straight around to get it secured in place. And I'm feeling with both hands to make sure that I don't have any wrinkles anywhere in here, because again, this can cause cording. Now what I want to do is wrap with even, consistent pressure. I'm going to go down, pull out any wrinkles, And I want to leave about 1/2 inch of padding at the bottom of my wrap here. Then I'm going to come back up the leg, and ideally I'll end up here at the top. So see how I have a wrinkle here? I can feel this with my hand and go around and straighten everything out. So while I'm wrapping, I want both hands on the wrap so that I can feel all the way around the leg where I can't see. That way I can make sure that my pressure is even and consistent all the way around. And that way I can straighten out any wrinkles as I'm wrapping instead of wrinkles upon wrinkles causing problems for Blondie's leg here. As you can see, I have 1/2 inch of padding at the top and bottom. It's also important that I check that it's not too tight, so I should be able to slide a finger in the top and a finger in the bottom. Again, it's also important that it's not too loose because he can mess with it or pull it off his leg. So I shouldn't be able to twist it, and I shouldn't be able to push it down or pull it down on the leg. As you can see, this stays in place, and I can't twist it, but I can still slide my fingers in. So this is a good tension. Another way to check that the tension is consistent through the entire wrap is to flick it and listen to the sound. And the sound should be the same from the top to the bottom and back up. The next bandage that I'm going to demonstrate is the stack wrap. If we have a wound that is higher up on the leg or we have swelling that comes up higher, we can't just use a regular standing bandage, and we can't just put a wrap on the top part because the top of the leg is wider and the wrap will just slide down and fall off, or the horse will get tangled up in the wrap. The solution to this is to use a stack wrap. What we do first is we put a standing bandage on the lower part of the leg, but it's going to come down a little bit further so that it can anchor right here at the coronary band. Then we're going to create a shelf here and then continue our wrap up higher. So I'm going to apply the first phase, which is the anchor phase of the wrap. Like the regular standing bandage, we start it on the bone in the groove on the inside of the leg and wrap our quilt as evenly as possible. Even if this isn't the affected part of the leg, it's important that we do a good job wrapping to avoid causing other problems. So I'm going to tuck all the ends in, straighten out, make sure there aren't any wrinkles. Ooh, Blondie. So this part is like the regular standing bandage. I anchor the end of my wrap down, and then I'm going to go down with nice even pressure and consistent wraps, straightening out all the wrinkles. I'm going to leave 1/2 inch, but note how it's a little bit lower so it can rest on the coronary band, so it anchors in a little bit better. And the narrowing behind the fetlock, that will help keep it in place as well. So there you can see where it narrows. Then I'm going to go back up the leg. And again, I'm going to feel the wrap all the way around because I want to make sure I'm not missing anything that I can't see on the other side. And it's very important that the Velcro ends at the top of this one, because when I apply the next wrap, I need to be able to cover the Velcro so that he can't reach down and take the bottom part of the wrap off. So my next phase is to get my next set of padding. And what I'm going to do with this is I'm going to set it right above this shelf that I have created here, and this will help me go higher up on the leg. And again, it's important that my pressure stays as even and consistent as possible, that I avoid wrinkles. And and then I apply this pillow as smoothly as I can so that the rest of the wrap can be wrinkle-free. Okay, so you see I've set it right in on top of the shelf. That way when it wants to slide, it has something to anchor into. Now this wrap, I'm going to start just above the knee. I do not want to start over the joint. But then I'm going to go down below the knee, anchor in the Velcro, and come back up. So once I get my end down here, then I'm going to come down below the knee, anchor the two wraps together, and then it's very important that I actually cover up this Velcro here. Once the Velcro's covered, I can go back up the leg, and the whole time, like the lower part, I'm feeling for any wrinkles anywhere. And I want to wrap as evenly and consistently as I can. And all these wrinkles I just smooth out as I go along. Now this Velcro, I ended above the knee. This is very important so that he can still bend his knee, but it didn't end quite as high as I want. So what I'm going to do is I'm going to take a third wrap here, and I'm going to start it over the Velcro and make sure that everything's covered and end a little bit higher up so that the wrap is very secure. And like all my other wraps, it's important that they're even and consistent. Make sure the Velcro is completely covered so that he can't reach down and undo it. And then I'm going to wrap up towards the top, keeping all the wrinkles out. And what I have here is my Velcro that ends at the top. Everything else below here is completely covered up so that he can't undo the bottom part and cause anything to slip in any way that it shouldn't. Now what I'm going to do, this part of his leg is wider, so the Velcro doesn't quite reach all the way over like I would like it to. So I'm going to grab some masking tape and go over it so that it stays in place. When I apply the masking tape, I don't want to just wrap it around his leg. I want to make sure that I actually covered the Velcro up so it does its job. And then what I'm going to do is spiral it. And this should help keep it in place. So if he plays with it, he won't be as likely to be able to get it undone. Now, just like the standing bandage, I should be able to stick a finger in the top. I should be able to stick a finger in the bottom. I shouldn't be able to move it or slide it down the leg. And it should sound the same when I flick it all the way from the bottom back up to the top. Now, something you've probably noticed as I've been doing these bandages is I'm squatting down so that I can do them, but I'm not putting my knees on the ground. This allows me to move quickly if he does something or if he were to react or try to kick me. So if he stepped towards me, I could easily step away without having to get my knees up off the ground. This is a safer way to do bandages. Well, the stack wrap and the stable bandage can be used to get swelling out of the horse's leg. They are often used over a wound. This would be a wound bandage. But it's important to know that you can't just put the pillow on over a wound and then wrap it. There's a couple extra steps if you're dealing with an injury. First of all, you need to clean the injury and then put an ointment on it, such as betadine ointment or Novocin ointment. The next thing you need to do is put a sterile non-stick pad over it. This keeps the ointment in, and it also keeps the rest of the wrap from rubbing the wound. As you can see, this is a little bit shiny on one side, and it's slick, so that when I take the wrap off and go to check them, it doesn't stick and damage any new tissue that is growing. They usually come in a little sterile packet like this, so that you don't introduce any new bacteria into the wound. The next thing is, if I have a wound here, I place my Telfa pad on it, and then I use clean gauze to keep the Telfa in place. I can't just put the Telfa on and then put the wrap over it, because the Telfa may slide down inside the wrap, and this defeats the purpose of using the Telfa in the first place. So you apply the Telfa, and then just a thin layer of clean gauze to hold it in place. Now you don't want the clean gauze tight, because its only purpose is to hold the Telfa in place, and you don't want the clean gauze tight underneath the rest of the wrap, because you can damage the structure by cutting off the circulation to the horse's leg. Now when you're wrapping a horse's leg for an extended period of time, such as you're treating a wound for several weeks, it is important that while it is a lot of work, you need to check the bandages at least every 12 hours. This way you can know if there is restricted circulation. You can discover if there were wrinkles or if there are any problems. If you leave it on for a longer period of time and there did happen to be a problem, there can be serious damage to the horse's soft tissues in his leg. Some of these problems are severe enough that they can be career-ending, not just unsightly. In addition, if you're using something such as a poultice or a sweat, you need to be checking the material you're putting in there and how the horse's skin is reacting to it. In many cases, horses will react to a sweat with something called blistering, where the skin starts to scurf in a reaction to the medication in the sweat. So it's very important that you check that the horse is comfortable with his wraps, that they're fitting correctly, and they are not restricting the blood flow in any way. When I'm applying bandages, it's important that I stay on my feet. It's okay to kneel down, but you must stay on your feet. The next thing that's important is that you apply them correctly so that you do not injure your horse. They need to be tight enough that they cannot move out of place, but they need to be loose enough that the horse can get blood circulation to the structures of the leg. It's important to be able to slide a finger in, but not move your bandages. It takes a lot of practice to get to a point where you can get the bandage on the way you want. If it doesn't go on the way you want, it's important to take it back off and try again, rather than go, oh well, it's okay, and leave it. Your horse's soundness is at stake, so this is very important.